Appendicitis, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Appendicitis, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of appendicitis. Chapter 1. 1. What is appendicitis? Appendicitis is the inflammation of the appendix. 2. Can appendicitis happen to anyone? Yes, appendicitis can happen to anyone. 3. Is appendicitis a common issue? Yes, appendicitis is a common issue. 4. Is appendicitis an emergency? Yes, appendicitis is an emergency. 5. Can a person live without his or her appendix? Yes, a person can live without his or her appendix. 6. What is the main function of the appendix? The main function of the appendix is unknown. 7. Is the appendix an organ? Yes, the appendix is an organ. 8. Is the main cause of appendicitis known? No, the main cause of appendicitis is unknown. 9. What is the cause of appendicitis? Appendicitis is caused when there is a blockage inside the appendix. 10. How can appendicitis be prevented? Appendicitis cannot be prevented for now. Chapter 2. 1. Can appendicitis be chronic? Yes, appendicitis can be chronic. 2. Is chronic appendicitis common? No, chronic appendicitis is not common. 3. What is chronic appendicitis? In chronic appendicitis, the signs and symptoms of appendicitis come and go, and also the signs are mild. 4. Is acute appendicitis common? Yes, acute appendicitis is common. 5. Is the appendix attached to the large or the small intestine? The appendix is attached to the large intestine. 6. Is the appendix at the lower left or the lower right of the abdomen? The appendix is at the lower right of the abdomen. 7. What are the signs and symptoms of appendicitis? The signs and symptoms of appendicitis include nausea, vomiting, sudden pain, constipation, diarrhea, loss of appetite, fever, cramps, swollen abdomen, etc. 8. In appendicitis, the appendix is filled with? In appendicitis, the appendix is filled with pus. 9. What are the complications of appendicitis? The complications of appendicitis are rupture of the appendix, abscess, peritonitis, sepsis, ileus, etc. 10. What is an abscess? An abscess is an accumulation of pus. Chapter 3. 1. What is peritonitis? Peritonitis is an inflammation of the peritoneum. 2. Is peritonitis a serious condition? Yes, peritonitis is a very serious condition. 3. Can peritonitis be fatal? Yes, peritonitis can be fatal if not treated. 4. What is the function of the peritoneum? The peritoneum protects the abdominal organs. 5. What is sepsis? Sepsis is a life-threatening condition in response to an infection. 6. Is sepsis a medical emergency? Yes, sepsis is a medical emergency. 7. What is ileus? Ileus is a lack of motility of the intestine. 8. How is appendicitis diagnosed? Appendicitis is diagnosed by abdominal exam, urine test, blood test, medical imaging tests, rectal exam, etc. 9. What is normally searched for in a blood test for appendicitis? White blood cell count is normally searched in a blood test for appendicitis. 10. What are the functions of white blood cells? White blood cells help to fight against infections. Chapter 4. 1. So, what does a high white blood cell count indicate for appendicitis? A high white blood cell count indicates an infection in appendicitis. 2. Give examples of medical imaging tests. Examples of medical imaging tests are X-ray, CT scan, MRI, and ultrasound. 3. What is a C-reactive protein test? A C-reactive protein test is a test used to check for an infection. 4. How is appendicitis treated? Appendicitis can be treated by abscess draining and/or appendectomy. 5. What is appendectomy? Appendectomy is the surgical removal of the appendix. 6. Appendectomy can also be called appendicectomy. 7. What is laparoscopy? Laparoscopy is a surgical procedure that enables the visualization of the abdomen or the pelvis. 8. What are antibiotics? Antibiotics are medications that fight against bacterial diseases. 9. What are medical conditions that have similar signs and symptoms as appendicitis? Medical conditions that have similar signs and symptoms as appendicitis include kidney infection, urinary infection, Crohn's disease, ovarian cysts, irritable bowel syndrome, ulcerative colitis, pelvic inflammatory disease, etc. 10. What is Crohn's disease? Crohn's disease is an inflammatory bowel disease. Chapter 5. 1. What is ulcerative colitis? Ulcerative colitis is a chronic inflammatory bowel disease. 2. Ulcerative colitis is also called colitis ulcerosa. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding appendicitis.